Get started. Welcome and good afternoon. Today is Tuesday, February 14th. I hereby call the Insurance Subcommittee to order. Madam Secretary, please call the roll.
Representatives Capley, Sapicki, Himmer, Hicks, Kumar, Lafferty, Martin, Mitchell, Rudd, Rudder, Terry, Chairman Haynes. You have a quorum.
Thank you. Before we get started, are there any personal orders? Seeing none, we have 7 bills on the calendar this week. First is item number 1, House Bill 1215 by Chairman Rudd. We have a proper motion and second. Chairman, you're recognized on the bill.
Thank you. I'll start to say good morning, good afternoon, I guess. We're about there. Madam Chairman and members, I'm here to present to you HB 1215 on behalf of Speaker Sexton. The legislation is known as the Managed Care Organization MCO Reform Bill. It's being introduced to reflect and protect the values of Tennesseans. The purpose of this bill is to prevent an MCO contracted with the Bureau of TennCare from covering a medical procedure performed anywhere in the country for the purpose of artificially changing a person's sex. Tennessee taxpayer dollars should not be used for such procedures. The bill prohibits an MCO, from which currently there are 3, from contracting with TennCare covering transgender medical procedures and reimbursing them for transgender medical procedures through the following: through the Bureau of TennCare, any private healthcare organization regulated by the state, any local or state insurance program of the MCO, any MCO operating in Tennessee and regulated by another state. A TennCare MCO may not offer transgender surgeries anywhere in the United States if they are contracted with an MCO and TennCare. This bill does not discourage or prohibit counseling. In closing, if the MCO covers transgender procedures within 90 days of the effective date of the violation, the MCO must come into compliance. If the MCO does not come into compliance within that 90 days, it is no longer eligible to provide medical assistance pursuant to this part. That's the bill.
Thank you. Do we have any questions from members? Chairman Sapicki, you're recognized.
Thank you, Madam Chairman. A couple questions. This only applies to the MCOs currently in Tennessee, is that correct?
Yes.
Chairman.
Does this prohibit any other healthcare providers from providing this care for their people coverage as long as they're not an MCO, is that correct?
As currently written, that's correct.
Okay. And so there are other healthcare options for people who do want to pursue this. If the MCOs stay in compliance with this law, there's other avenues for those people to explore, is that correct?
Both in the state and out of state.
Thank you. Thank you, Mr. Chairman.
Representative Mitchell, you're recognized.
Yeah, thank you, Madam Chairman. I've got just a couple of questions for the staff attorney. I'm just wondering how this legislation would affect the 14th Amendment, equal protection under the law, as well as the Commerce Clause.
We'll go out of session and hear from Matt Mundy.
Matt Mundy from Legal. I don't believe that, at least in my reading of it, that I believe that there's an equal protection issue in terms of differentiating between classes. But if there were to be, I would suspect that there's arguments to be made on both sides as to whether the state's interest is sufficient to overcome a challenge based on the 14th Amendment. I think that it would be difficult for me to take a position on something that would be a question of first impression, I think, in Tennessee. And your second was the Commerce Clause. Yeah. I'd considered that issue. I don't think that I think it would be the Dormant Commerce Clause maybe would be a potential issue. But in going through the analysis, I think that the state's interest in regulating this particular area would probably be sufficient to overcome that challenge as well.
We are back in session. Representative Mitchell, you're recognized.
Well, that's interesting that we can, control what an MCO does in other states. So that's great concept. I guess we may need to look at other laws. Thanks.
Chairman Rudd?
This does not control what they do in other states. It simply states that a MCO that's providing this service in other states can't have a contract here.
Thank you. Any further questions? Chairman Sapiki?
Just for clarification, Mr. Chairman, an MCO that doesn't want to abide by this law, they could still do business in other states without a problem, correct?
As currently written, that's my understanding, yes.
And if an MCO doesn't want to abide by this law, they can still offer insurance in Tennessee, they just can't be an MCO, is that correct?
What, would you repeat that?
If an MCO does not want to abide by this law, they can opt out of being an MCO and still offer insurance in Tennessee, is that correct?
Yes.
Thank you.
Representative Himmer?
Thank you, Madam Chairman. As part of the Affordable Care Act, there's a section 1557, which states that prohibits discrimination in health care on the basis of a number of protected characteristics, including sex. How would this state law, be affecting that federal preemption?
Well, as far as I know, of course, under Tennessee law, this is defined as sex, your biological, and the type of definition you're talking about, as far as I know, is not covered under federal. So you're talking about sexual orientation or sexual choice. I'm talking about biological sex at birth.
Thank you. What would happen if no MCOs would be able to provide care due to this act? How would we administer it?
There are already plenty of MCOs already wanting to be one of the treasured 3 right now, so I don't think that would be an issue.
Any further questions? Representative Mitchell?
Yeah, Madam Chair, do we have any testimony from the public that have signed up for this?
Yes, we do.
Okay.
We're
Are we
go out
gonna-
of
are we
session
gonna
and
hear from those?
Yes, we are.
All right, thank you, ma'am.
We are now going to go out of session. We have 7 people here to testify. Thank you for joining us today. The first up is Ray Holloman from the Tennessee Equality Project. Is he here? Thank you for joining us today. You have 3 minutes for your testimony. Can you please introduce yourself and tell us who you're with for the record? I think your mic, is it on? Little red light.
Is that better?
Yes,
Okay.
thank you.
My name is Ray Holloman. I'm here with the Tennessee Equality Project.
Okay.
I am a Tennessee native, and I've lived in my home state for the last 32, almost 33 years. I'm also a transgender man, and I'm urging you all to vote no on HB 1215. TennCare already does not allow for gender-affirming services through the health care plans that are provided to Tennesseans. HB 1215 makes it so insurance companies who apply for the TennCare contract cannot be reimbursed for gender-affirming services anywhere in the U.S. Gender-affirming services are life-saving and should not be taken away in any form or fashion from the people who have it. This could lead to not having any managed organizations that are willing to contract with the state, as these organizations have to comply with the Affordable Care and Medicaid Acts. If TennCare cannot deliver services under the managed care model, the organization may be forced into the much more expensive fee-for-service model that would be much more expensive for the state to manage. There's also an additional impact on companies that offer gender-affirming services as part of their services that now could become potentially limited for insurance companies that they can use in this state to be able to provide these services. TennCare does not allow for gender-affirming services. What is the gain of this bill except to hurt Tennesseans who want to be able to use insurance that they pay for to provide the services that they need? This bill takes away necessary health care from transgender Tennesseans like me, while other Tennesseans can receive the care that they need. While only 1.6% of the population that is trans, a lot of focus is put on attacking the transgender community. This is just another prong of the attack against my community. With this bill, the way it's written, it only opens the state to additional lawsuits from insurers, residents, and the federal government. And as many have said, Once a person turns 18, they have the right to do as they wish, including transition. This bill flies in the face of those statements as well. HB 1215 is not good for anyone in this state, whether they are transgender or not. It will limit the bidding process for the managed care organization taking care contracts or force the state into a fee for services if no one acquiesces to the no reimbursements for gender-affirming services for any state or person. Everyone in this state deserves access to health care that they need. So again, I urge you to vote no on HB 1215 as it does not benefit Tennessee at all. Thank you.
Thank you. I'm going to ask you to remain seated, and I'm going to let everyone speak, and then we'll have questions. Next up is Seth Likens. Can you please say your name and who you're with for the record?
Hi. Is my microphone on? Are we on? Hello.
Yes, you are.
Hi. I am Seth Likens. I'm representing myself. Good morning, representatives. My chosen name is Susie. I moved to Tennessee over a decade ago to attend Lipscomb University. I graduated in 2014, and I have since moved east of Nashville to live a rural country life. I am speaking today to encourage you to vote no on House Bill 1215, which will prohibit gender-affirming care through TennCare. I am speaking as someone who receives life-giving gender-affirming care. In 2017, at the age of 24, I received a bilateral orchiectomy. For those who are unfamiliar with that term, I had both of my testicles removed. I had to go out of state to an informed consent urologist to receive this care. I did not have insurance at the time, and I had to sell my car in order to pay for my surgery. I was lucky that it was possible for me to be able to afford this care. Many trans people are not in a financial position to be able to do something like this. This surgery changed my life. It relieved me of a deeply uncomfortable bodily sensation that had distressed me for years. It increased my physical, emotional, and spiritual sensitivity. Because of the surgery, I can more clearly feel the presence of God. Like many of you, I was raised in Christianity. While I firmly believe in the separation of church and state, I understand that religious biases currently affect your legislative process. Thus, I must name the historical presence of eunuchs in the early Christian writings as examples of people who underwent bodily transformations and served in sacred roles that were granted high status and honor in early Christianity. In Matthew 19:12, Christ says, "For there are eunuchs who were born this way, and there are eunuchs who have been made eunuchs by other, and there are those who chose to live like eunuchs for the sake of the kingdom of heaven. The one who can accept this should accept this." Christ carves out a space for eunuchs to exist within his theology. Christ names the importance and power of eunuchs as a part of the kingdom of heaven. While it is incorrect to call the eunuchs of biblical times trans people, they are clearly described as people who exist outside of a traditional gender binary, who have elected to undergo bodily transformation for the glory of God. The parallels to contemporary trans people are evident. Trans people are sacred. We bridge the space between male and female and serve to integrate disparate parts of our communities. Trans people deserve affordable access to health care that allows us to express our sacred blessings. Limiting insurance access will create a system where only wealthy trans Tennesseans are able to afford transition, leaving behind poor and working class trans people. As Christ says, "Blessed are the poor, for they shall inherit the kingdom of heaven." Trans people of all economic classes deserve access to gender-affirming care. I pray that trans people are blessed, supported, and funded by state insurance in our sacred medical transitions. Thank you for your service.
Thank you. Next up is Ocean Ray. Please state your name and who you're with for the record, please.
Hello. Good morning, afternoon. My name is Ocean Ray, and I'm representing myself. I'm not with an organization at this point in time. I'm a resident of Tennessee, DeKalb County. I'm a registered nurse, and I'm a trans person who receives gender-affirming care. I'm urging you all to vote no on HB 1215. In my role as a nurse, I've worked in hospitals all over Middle Tennessee. It is possible that I've worked with and cared for your family members, or maybe you when you were ill. If I did, I'm glad for that, because I always strive to care for people with love, respect, and dignity. Those are my values, and that is what is important to me. The values of all Tennesseans are not represented by this bill, Representative Rudd. I'm a fierce advocate for all of my patients getting the care that they need. We are all, each one of us, me, Susie, Representative Rudd, Chairwoman Haynes, worthy and deserving of care. For me, that is not a difficult concept. I am inspired to care for people by the ways that my community and family care for each other, the ways that I've seen that care demonstrated in the world, and in the teachings of spiritual leaders. That care is an expression of my love for humanity, my belief in all of our inherent goodness, and my gratitude for being here on earth at this time and able to care for people. I believe that when the most vulnerable among us are cared for, we are all cared for. Whether the source of that wisdom for you is Matthew 25, the Bodhisattva vow, or Black feminist wisdom, the message is the same. I ask you this, is it not absurd for a legislative body to assume the ability to pick and choose how people receive life-saving medical care? I'd also like to ask why limit life-saving care for trans people? I'd like to ask, when and where does that reach end? To me, it feels like a slippery slope. I'm a trans person who's created a life and a home in Tennessee for the last 15 years. I'm from rural Georgia, and I love living in rural Tennessee. I feel like the land knows me, and I know the land, and we care for each other. Trans people have existed since the beginning of human existence. We have been healers, spiritual leaders, performers, caregivers, and we have worked with the land. We are all, not just trans people, in this life made to feel like we don't belong, that we have to be perfect in order to be worthy of love and care. The truth is we are already perfect. We have just at some point internalized a message that we aren't. Regardless of what happens with this bill, trans people will exist, we will thrive, we will access health care, and we will care for each other because we always have. Representatives, I pray for you all daily. I pray and I hope that you all have what you need in order to feel safe and whole, that you access the love, care, and support that is available to you. I pray that you will find and nourish your own humanity, and I pray that that is a humanity that does not need to deprive, terrorize, and oppress others in order to feel justified in its existence. May it be so. Thank you.
Yes. Red button.
Okay, is that better?
Yes.
Okay, great. Hello, my name is CJ Desai. I'm not with an organization. I'm an acupuncturist, nationally certified and licensed in the state of Tennessee, a divinity school student here in Nashville, and a person who receives gender-affirming care. I'm here today because I oppose HB 1215. I've worked in a medical clinic that provides gender-affirming care to trans people, and I have focused my career in acupuncture and now chaplaincy on providing care to underserved people like low-income folks, veterans, and transgender people. I sat down to write this testimony and tried to settle on an approach. I could gather and quote statistics about the high rate of suicide among trans kids and adults who are unable to receive gender-affirming care, or make a list of all the credible medical organizations that support gender-affirming care for people of all ages. But I know you've heard that. I could tell you my own story or one of hundreds of stories that I know from being in trans community and working with trans people about the importance of this care. But you've already heard those stories too. There is no medical treatment that is 100% successful, but for the vast majority of those who receive it, roughly 98%, gender-affirming care is life-giving. Taking this care away from vulnerable populations is then life-taking. When transgender people come here to speak for ourselves, it's not political, it's personal. I spend my days trying to get an education, make a living, care for my community and my family. I do not spend any time thinking about how to maintain my rights, but it seems there are people who spend a lot of time thinking about how to take them away. In trying to maintain access to adequate health care, we are not trying to remake anyone else in our image. We are only trying to imagine a future for ourselves. I wonder if the people who support this bill can say the same thing. If we stop showing up in these hearings, it won't be because we don't care anymore or because we cease to exist, but because we lost hope. hope that we can have access to the same rights given to any other resident of the state of Tennessee, but we will still be here. My hope is that you will listen to the people this law affects, not people who don't know anything about us, to professionals, not podcasters. My hope is that you will listen to experts. This includes parents of trans kids, transgender people of all ages, and current, credible medical science and healthcare professionals. Thank you.
Thank you. Next, we have Malcolm Brown. Please state your name and your affiliation.
Hello. My name is Malcolm Brown. I'm here with myself.
Thank you.
I bring into this room the following intersecting identities. I'm a Protestant Christian pursuing a master's in divinity. I'm a heterosexual African-American cisgendered man. I'm a diversity, equity, and inclusion professional. I'm a citizen of this nation, and I'm a resident of this state. Today, I'm here to speak in opposition of HB 1215. TennCare's stated mission is to improve lives through high-quality, cost-effective care to support the vision of a healthier Tennessee. TennCare acknowledges that in accomplishing this mission and vision requires partnership between the provider community, stakeholders, advocates, families, and TennCare employees. Today, I am here to advocate for lives to be improved and for a healthier Tennessee. Doing so means we must ask the question, what is a healthier Tennessee? How is it possible for us to separate the health of the state from the well-being of its people? If our mission is to improve lives, how does the care we provide or withhold reflect that commitment? On what grounds do we qualify our right to determine the standard of care people are entitled to receive? To dictate who is and is not worthy of care, whose distress is or is not worthy of attention, starts us down a path from which we will never realize the stated mission of TennCare. All lives are worthy of being improved. When asked which was the greatest commandment, in Mark 12, Jesus replies, "Love the Lord your God with all your heart, with all your soul, and with all your mind, and with all your strength," before adding, "Love your neighbor as yourself," concluding that there is no commandment greater than these. In reading this passage, I find most convicting what we are commanded to do. When asked who our neighbors are, Jesus tells the parable of the Good Samaritan. In the parable, the title character shows mercy to a stranger unable to fend for themselves, providing care and ensuring well-being. To speak of loving our neighbors as ourselves while refusing to recognize the dignity of and care for those we perceive as different is a false religion. I am here in opposition of this bill because its mandate is to deny care. I am here because I believe it is necessary and just to speak out against systemic evil and abuses of power. I am here as witness that not only trans people care about trans people. Thank you.
Thank you. Next, we have Lynn Purvis. Please state your name and who you're with for the record, please.
My name is Lynn Purvis, and I'm here representing myself.
Okay, I think your microphone, you need to turn that on.
Okay, it already had a red light. My name is Lynn Purvis, and I'm here representing myself. I also live in Cannon County. I'm also a cis woman, and I am a court interpreter in the state court system. So speaking of courts, I'm going to kind of review some of the things that have happened in the courts over the last couple years. In 2020, the U.S. Supreme Court decision in Bostock versus Clayton County clarified that discrimination based on sex includes sexual orientation and gender identity and is prohibited by federal law. Last year, the U.S. Department of Health and Human Services, they published guidance clarifying that Section 1557 of the Affordable Care Act prohibits discrimination on the basis of gender identity in access to covered health programs and activities. And I'm going to quote here, "A provider's view that no gender transition or other gender-affirming care can ever be beneficial for individuals, or its compliance with a state or local law that reflects a similar judgment, HB 1215, is not a sufficient basis for a judgment that a health service is not clinically appropriate." An explicit, categorical exclusion or limitation of coverage for all health services related to gender transition is unlawful on its face. And that's a quote. Now, in June of 2021, the ACLU, on behalf of 2 transgender women, sued the Georgia Department of Health for denying Medicaid coverage of their gender-affirming surgeries. The suit alleged violation of the U.S. Constitution, the Affordable Care Act, and the Federal Medicaid Act. The lawsuit settled last year with Georgia's Medicaid plans agreeing to adopt benefits and clinical guidelines for the treatment of gender dysphoria, including benefits for gender-affirming surgery. And then they had to pay $350,000 to the plaintiffs on that suit. In CP versus Blue Cross Blue Shield of Illinois, this was a class action lawsuit that was brought on by a woman and her 16-year-old transgender son. He was 15 at the time, I believe, of the denial of services. And a U.S. District Court in Washington State concluded in December of 2022, just a few months ago, that because a health insurer received federal financial assistance, all of its operations were subject to Section 1557. The judges said, quote, Blue Cross, as a third-party administrator, is a covered entity under Section 1557 and has discriminated against the class plaintiffs by denying them services for gender-affirming care under their insurance policies. They were ordered that if they were going to provide health care, they must provide gender-affirming care. So it's crystal clear that there is no legal standing for this type of exclusion of services. And I again ask, what adequate MCO are we going to find that is not receiving federal funds? And I also wonder, how can TennCare itself, as a Medicaid program, which I understand to mean receiving federal funds, how can they categorically exclude protected health services? Down the line, or is this going to be a matter of having to reject federal
Ms.
funds?
Purvis, I'm sorry, your time is up.
Can I just please wrap my last sentence up? Okay. Our state lawmakers so dead set on shunning trans people that they're willing to face, lose, and pay for lawsuits by passing an obviously illegal bill. This is not a smart insurance decision, just another stab at trans people in our state. We will continue to love, support, and affirm trans people. Happy Valentine's Day.
Next up is Juliet Allen. Does someone mind changing places with Miss Allen? Thank you. Please state your name and who you're with for the record.
My name is Juliet Allen, and I'm with myself.
Thank you.
My name is actually River. I live in the small town of Liberty, Tennessee. For the past 5 years, I've been working as a caregiver for a trans elder who is bedridden and her 84-year-old husband. That's in Woodbury, Tennessee. I recently had a legislative visit with my state representative, Michael Hale, in order to communicate to him the deadly damage that HB 1 would have on my community. This was the first bill attacking gender-affirming healthcare for youth, and clearly the bill was not about protecting children from irreversible changes to their bodies. Children can legally get liposuctions, calf implants, nose jobs, breast enhancements. This bill was about eliminating trans people while they were still children. And now HB 1215 confirms that this was never about children in the first place. During our talk, Representative Hale speculated that the reason why so many trans people in the USA lived in the South was because Southern communities, and especially rural Southern communities, were welcoming and inclusive. And it honestly tugged at my heart to hear him say that, even while it was delusional. I love my home. The small wave that rural folks give each other when we pass each other on country roads, the way people who do not necessarily understand my identity will still give me the best gardening advice at the farmer's co-op. But in Tennessee, there are no state or local non-discrimination policies that protect LGBTQ people. And now the state legislature has passed dozens of laws that directly attack trans people. Gender-affirming healthcare was already difficult to access. Now, by making these expenses out of pocket, you will force many to self-manage our own care at great risk without the support of doctors. Your denial of trans people's existence or validity does not make us cease to exist in the state of Tennessee. As you must already know, there's no legal standing for blocking TennCare MCOs from covering gender-affirming care or choosing not to have MCOs that do so. Similar efforts have lost court battles in other states because they violate the Affordable Care Act via Section 1557 and the Federal Medicaid Act, amongst other things. Today, vote no on HB 1215. Show us that you are more interested in passing good, sound policy that's well-crafted and thoughtful for the benefit of every Tennessean than in scoring political points to satisfy a far right-wing extremist base. Thank you.
Do we have any questions or comments from the committee? Representative Mitchell, you're recognized.
Mr. Malcolm Brown, is that correct? Hey, I appreciate you coming here today, and your statements, a lot of what you said was not any legal statements, is a basis of hopefully how many of us form our morality. And, you know, those were the statements you made, and most were from Christianity, were not legal statements, like I said, but probably reason why I ran for office. You know, I ran for office to help people and to give more people care, you know, to give more Tennesseans care, not to take things away from people. So with what you said, I hope a lot of the committee listened to you and thought to themselves, hey, that's how I formed my reasoning for the reason I ran in the first place. And with that being said, I'm not going to argue this bill very much more because the speaker after you made it quite clear this committee can pass it, the next committee can pass it, we can pass it on the House floor, it can be signed by the governor, but the first light of day in a court it sees, it's going to be thrown out in about 5 minutes. So with that being said, I'm done. Thanks.
Any further questions? We are back in session. Chairman, do you have any further discussion on the bill? I'm sorry. Witnesses, you are dismissed. Thank you. Chairman, you're recognized.
I just want to say that this bill does not deny treatment. It does not deny access to the transgender community or any community to health care. They can still, if they need medical treatment, if they need counseling for this, or if they have a broken leg, or if they have other COVID-19 or other, they can still receive treatment. To deny them treatment based on being a transgender would be discrimination. This bill does not discriminate, and it also does not outlaw the surgery, as it has in some states. It just simply states that Tennessee tax dollars are not to be used for it. Very plain, very simple. And I think that that speaks to the bill itself. It's a very simple bill, what it does, and regardless of what has happened in Georgia or other states that go well beyond this bill is very narrowly defined.
Do we have any questions from members? Representative Hemmer.
Thank you, Madam Chairman. I was wondering if it's possible to hear from TennCare on this bill.
They didn't ask to testify.
They are not signed up, so no, I'm sorry.
Okay. I would like to request the TennCare officials could please check with legal after reading this. It's Section 1557. I was just curious how this legislation would affect our federal funding for TennCare. Thank you.
Thank you. Any further questions? We are now voting on House Bill 1215. All those in favor of sending House Bill 1215 to insurance full signify by saying aye. Aye. Opposed? No. The ayes have it. Bill goes to insurance full. Item number 2, House Bill 1213 has been rolled 1 week. House Bill number 3, House Bill 152 by Chairman Hazelwood. We have a motion and second. Do you have an amendment?
I do have an amendment that makes the bill, Madam Chairman. It's drafting code 3793.
We have a motion and a second on the amendment. Chairman Hazelwood, you're ready to speak on the bill as amended.
All right, and the amendment, as I said, does make the bill. This bill is the hospital assessment bill that we have been passing and dealing with since 2010. And I think the bottom line about this bill, it'll bring $1.8 billion to the state for TennCare services. There are a couple of changes that I'll go through. As I said, it was first passed in 2010, and this year's bill continues the current assessment rate, which is 4.87%. That is not changing, but the 2023 assessment is based on data from the 2019 Medicare cost report. Previously, that information was based off the 2016 Medicare cost report. And as we all know, in 3 years, many things have changed. That's just the latest numbers that we have, so that's what we're dealing with. The change is necessary to realign revenue with costs so that we can continue to cover services that are provided to the TennCare population. I think it's worth noting that over the last 12 years, the annual amount of funding for the items that THA continues to cover has increased by $294 million. And hospitals have funded a total of $139 million in just growth alone. All money, for those of you who are new on the committee and maybe new to this legislative body, but all of the money collected under this assessment goes into the trust fund to provide the state share of funding for the TennCare program. In order to do this, the reason this program was implemented in 2010 was to prevent cuts that otherwise would have had to be made in TennCare services, would have included things like hospital, physician, and health professional rate reductions. And we know if you hear from your physicians and your doctors, that's redundant, from your physicians and hospitals and other providers at home, then you know that TennCare rates are, none of the providers think that they're where they need to be as is, much less to be cut. It also provides funding for critical access hospitals, particularly public hospitals that are providing charity care. So this legislation would also, this is an important point, again, for those who've not dealt with this before, but the legislation is specific in that this does not allow the hospitals to pass this assessment through. It is not a pass-through to the end user. It specifically says that no surcharge to patients can result from this assessment. And again, that's been part of the bill since 2010. And this amendment, this particular year, also includes language that will provide some immediate one-time assistance using assessment dollars that are available due to the enhanced federal match during the pandemic to offset charity care costs, which, as most of you know, again, if you hear from your hospitals at home, from your providers, that those costs have gone up. With that, Madam Chairman, I would take any questions.
Okay. We are actually going to vote on the amendment. So all those in favor signify by saying aye. Aye. Opposed? The ayes have it. The amendment is on the bill. Does anybody have any questions for Chairman Hazelwood? The question has been called. All those in favor of sending House Bill 152 as amended to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to insurance full.
Thank you, Madam Chairman. Thank you, committee.
Thank you. Item number 4 is House Bill 893 by Chairman Reedy. We have a proper motion and second. Chairman, you're recognized on the bill.
Thank you, Madam Chair and committee, and this is my annual pilgrimage to this committee for the ground ambulance to extend them for another year, and for the sake of our new members, let me explain. Patience. The ground ambulance assessment was created in 2018 to help fill the gap between the expenses incurred by ambulance services to perform a transport and what Medicaid reimbursements for this transport. Without using any state dollars, the ground ambulance service pays into a fund that draws down over $20 million in federal funds that is then paid back out to these services based on their Medicaid transport. House Bill 893 will extend the ground ambulance assessment for another year. please do.
Any questions
Madam
from the
Chair.
members? Seeing, question has been called. All those in favor of sending House Bill 893 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to insurance full. Item number 5 is House Bill 371 by Chairman Darby. We have a motion and a second. Chairman, you're recognized on the bill.
Thank you, Madam Chair and committee. House Bill 371 was brought to me by the Tennessee Disability Coalition and seeks to amend the ABLE Act. In 2015, the General Assembly passed the ABLE Act, which gives people with disabilities the opportunity to save and invest in a tax-free savings account that helps them maintain independence and improve quality of life. This bill gets the estate recovery claim in line with what CMS currently requires, that only allows for TennCare to do an estate recovery claim for those who pass away that are 55 and older. The Treasury's Office and TennCare are both okay with this bill.
Any questions from the members? The question's been called. All those in favor of sending House Bill 371 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to insurance full.
Thank you, Madam Chair and committee.
Item number 6 is House Bill 355. It's been rolled 1 week. Item number 7 is House Bill 1318. It has been rolled for 2 weeks. That concludes our calendar. Before we close, does anyone have any announcements? Do I have a motion to adjourn? We are adjourned.